I'm going to give everyone a couple more minutes to get settled in, and then we'll start. Thank you. All right, I'd like to get started. So I am Carolyn Moore, Suicide Prevention Coordinator with the New Mexico Department of Health. Welcome to the New Mexico Coalition for Suicide Prevention and Awareness. Today, our quarterly meeting on January 23rd, 2026. I appreciate you all for being here today and for your dedication to preventing suicide in New Mexico. I'd like to take a moment to thank Felicia Tushman for being our scribe today, and to Paul Bierce and Kate Reeves for chairing our coalition and working with our work group facilitators. And I'd like to thank our presenter, Dylan Pell. He is our New Mexico Department of Health mental health epidemiologist. Dylan will provide the 2024 New Mexico and National Suicide and Suicide-Related Behaviors data update today. Each data point is not just a statistic. It is a person's life. Dylan helps make sense of the numbers that DOH collects. We will also hear from Anna Maria Dahl. She is our DOH Violence Prevention Unit Program Manager about the upcoming RFA applications for DOH funding, which you all may be interested in. So quickly, I've got a few housekeeping items. The meeting is being recorded and it's going to be available for viewing on nmcspa.org website and on YouTube at nmhealth.org. We are always looking for new members and better ways to reduce suicide, and we can only do that with a lot of hands. Please spread the word about joining the coalition. Our quarterly meeting dates are on the fourth Friday of the month, and I hope to see you back here on Friday, April 24th. With that, I'd like to invite Paul or Kate to remind us about self-care, and then the floor is yours. Thanks so much.
Hi, thank you, Carolyn. This is Kate Reeves. I am the sitting chair-elect, interim chair-elect. Thank you all for being here today. We're very excited every quarter to bring all of you together to discuss suicide prevention. So as a reminder, the topics that we do cover can be a little bit heavy. So if at any point, we really encourage you to step away. If you need, don't feel like you can't. Self-care with heavy topics is extremely important. And again, we encourage you to step away should you need to. Paul, are you
Thank
there?
you.
Yeah.
Yeah, I'm here.
Okay,
Sorry.
I was just gonna let you introduce yourself real fast, being the chair.
Okay. Good morning, everybody, and thanks for logging on. I'm actually at the Roundhouse today. We have a suicide prevention advocacy day, and so we are actually set up in the rotunda. We've got quite a few um, agencies represented, and we've got some great traffic. So I am in one of the side halls here to do to be part of the meeting, but Kate's probably going to handle the majority of it since I'm kind of being pulled in a couple of different directions. But this is a great way to spread the word. And like I said, we're getting a lot of people interested in the coalition and our efforts. So thanks again for being here, and I appreciate everybody's efforts and working on initiatives and everything that we do to prevent suicide in the state. So thanks very much.
Thank you, Paul. So at this time, I would like to introduce Dylan Pell. He's our DOH mental health epidemiologist with his presentation. And Dylan, are you able to share your slides with us?
I hope so. We'll find out.
Okay.
Try. Okay. And I just now, Carolyn, I sent you a PDF of the slides that can be shared with people because in case that question comes up. Let's see. Okay, can you see a slide? Is that showing up? Okay. Before I jump into slides, I want to just do a little bit of introduction, see a lot of familiar faces, but tell you a little bit who I am and about our program, and I guess what to expect. So I'm going to press enter in the chat, and this will have my email, phone number, and a link to our mental health page at NMDOH. My name is Dylan Pell. I work as an epidemiologist on mental health topics, so not just suicide, but you know, both things like depression, anxiety, and the presence of wellness. Before I was an epidemiologist, I worked as a social worker with unhoused adults and did case management and other services for a number of years before I took this job. And I guess I just want to say thanks. I know a lot of you are doing advocacy today at the Roundhouse, and that all of you are leaders in our community. If you hear or see things in the presentation that don't resonate with you or feel like they were either said right or feel like they are true, please let me know. I really think that the lived experience and the knowledge of our community is part of the epidemiological process. It's not just what's in our data sets. It's really integrating the understanding of communities and people doing the work. I'll also say that you all may have some real awareness of things going on right now that I don't, because I'm looking at data sets that are from data collected over the past couple of years. And I don't necessarily know what's going on last week or the month before. And so I always look forward to these meetings to hear from people. guess the last kind of housekeeping thing is I have to step away at 11, so I'm gonna try and end early so for some Q&A. But I'm kind of annoyed that I can't stay for the whole meeting. I usually try to do that. But if I run away, that's why. But please call or email me if I can provide more information to you or answer any questions. Okay, so I'm gonna move over to the slide deck. And I would encourage people to just interrupt or ask questions, but I might not be able to see the chat with the way my screen is set up. So I'll try to follow, but feel free to just unmute and yell at me if needed. Okay. So we always do, I think this is either me or another epidemiologist have done a presentation for at least the last 4 or 5 years I've been here. I think this is the 3rd or 4th time I've done one. Just to kind of re-echo what Kate shared, I'm going to be talking primarily about suicide statistics. So the aggregation of all the people who have died or have had a mental health related issue. I want to acknowledge that these statistics are about our community, about us, and it's totally okay to step away or do whatever you need to do or take a break from this presentation if you need to. And the main thing I need is just if you hear me talk in a way that you find like offensive or not helpful, either let me know publicly in the meeting or reach out to me privately. I'm sure you're not the only one who feels that way, and I don't want to keep saying hurtful things if I can help it. So, but I can learn if people talk to me. So, the last thing I just want to say is I think probably most people, hopefully everybody here knows about 988. But 988 isn't just for the clients we work with, for our community, for the people we meet with, it's for us. And I just really want to encourage people here to reflect and value their own health and mental health. I'm a person who got a master's degree in social work before I saw a therapist or got mental health help for myself. And I don't think that was the right way to go about it. I think I could have got help earlier and the benefits would have been better for me had I done that. And so I just know that we're in a room full of caring people and just want to encourage you all to, value yourselves and take care of yourselves too. Okay. I'm gonna sort of just talk a little bit about the data sources, but I'm happy to answer detailed questions about them. So the New Mexico Department of Health is the state's public health authority. That means that we have the ability to do analysis of large population data sets, like all the death records in the state or emergency room records. The data you'll see today comes from a few different places. We conduct a couple surveys in partnership with the CDC. So the Youth Risk and Resiliency Survey is a survey of high school and public school, middle school students. We attempt to sample a survey at every school district in the state and typically sample around 40,000 students every other year. It's not just a survey about mental health, it's a survey about general health and public health issues, but we have some suicide-related measures because suicide is and has been a leading cause of death among young people. We also conduct a survey of adults called the Behavior Risk Factor Surveillance System. It's a telephone survey. I think it's actually the largest health survey in the world, or it was at one point. And I might have one slide that comes from the Substance Abuse and Mental Health Service Administration, not from our agency, called the National Survey of Drug Use and Health, where they survey adults and adolescents and focus on mental health and substance use topics. Today, we'll be sharing a lot of records that come from death certificate data. So when a person dies and the death certificate is issued, those death certificates are put together into a data set that can be used for analysis. When people die of suicide or other what's called an unnatural cause, the Office of Medical Investigator typically conducts an investigation of the death to determine the cause of death. So there's a kind of extra layer in those types of deaths than other causes. Lastly, I might share a couple slides showing how we can look at emergency room data to see sort of how suicide attempts or other topics are viewed in sort of healthcare system data. The last comment, which I don't have a slide for it because this just happened yesterday, is I think the cool thing that happened over the last couple of months is several people worked on a proposal to make suicide attempts a notifiable health condition. And I think we just got notice yesterday that as of now, it is a notifiable health condition in New Mexico. Notifiable health conditions are often things like infectious diseases, and that means that it improves our ability to like quickly receive information and respond, and also allows for some like real-time public health activities to respond to individuals who might benefit from a public health response. So we don't really know what that'll look like yet, but I just wanted to say that's something that might appear maybe next year's deck or a future one, or you might hear more about that. But I think that's good news for our ability to respond. Okay. So I wanted to start with what we shared last year and then kind of look, actually, let me make sure that, yep. Yeah, so I want to share what we had last year. And this slide is a little bit different because it's showing 2023 because that's the most recent year that the CDC has released data. So for our comparison data to other states and for the comparison to the national rate, we still have to use 2023. I will put a note that it's unusual for the CDC to have not updated their death records portal by this time. Yeah, that's what the note at the bottom is saying. Sorry, I'm just remembering the slide now. So in 2023, New Mexico had the 5th highest rate of suicide. We were behind Alaska, Montana, Wyoming, and Idaho. I just want to make a note that a lot of the states that have the highest related suicide rates may have some common characteristics. They're often large geographical areas with smaller populations. They're often mountain states. They're often states with like higher ownership of guns, and they're also higher altitude states. When we compare ourselves to the United States, New Mexico had almost a 60% higher rate of suicide than the US rate, and a rate that was more than triple New Jersey's rate in 2023, which was the state with the lowest rate. And I even have a bar chart a little later that shows all of this in a graphical form. In 2024, this is the newer data we're sharing today. So I know people often are expecting to hear 2025 data in January 2026. But the reality is that the Office of Medical Investigator hasn't actually issued the cause of death for people who say died in December and November yet, and that the actual creation of these data sets is done in partnership with a lot of people. So the records are done by the Office of Medical Investigator, and then they're sent to the National Center for Health Statistics at CDC, who do a final coding, and then they send them back to our Vital Records Office, who puts them together into a data set. And it's often not until fall of the following year that we have a complete record to report on. But in 2024, there were 513 deaths. This was an average of about 10 deaths per week. Consistent with previous years, we had about a much higher rate among men than women, with about 4 men dying of suicide for every 1 woman. And the highest rates of suicide in 2024 were among white New Mexico residents. The next numerically highest rate was among American Indian Alaska Native residents. However, it wasn't statistically significantly higher than any of the other groups. Only white residents had a statistically significant higher rate. One thing that is concerning me is that we're seeing more and more younger adults with high rates of suicide death in New Mexico. And by young adults, I mean those like the 18 to 34 age range. I remember presenting these slides a few years ago, and I was not always that age group. It was either sort of like middle-aged adults and older adults, but there seems to be in the last few years a trend towards our younger adults dying of suicide. More than half of the suicide deaths in New Mexico used a firearm. And compared to 2023, the rate of suicide in 2024 was almost 10% higher. If anybody was attended the presentation from last year, you might remember, probably on a slide in the future, but we actually had about a 10% drop in 2023. So the 2024 number is very similar to 2022 and before, and the drop in 2023 looks like a 1-year anomaly and was not a beginning of a trend, or possibly 2024 is the anomaly, but it's pretty consistent with the remaining years. But we'll see that on some trend lines. So yeah, this is a graphic showing by state. So New Mexico is this bar on the left. The United States is there in the middle, and you can see New Jersey and Washington, D.C. on the far right. And this one's a little outdated because it's 2018 and 2023, so that's why it's a 74%. And it's also combining 5 years instead of a single year. Anyways. People always ask about geographical views, and so I did create a slide on it, but I wanted to put these gigantic confidence intervals on there and just take a minute to talk about them. So what's showing here is the rate of deaths by county in New Mexico. So the highest rate in 2024 was Catron County, followed by DeBaca. The thing to note here is that the counties with the lowest populations can have a very
Dylan, you've cut out your, if you'd like to start that sentence again, please.
Thank you, Carolyn. Sorry about the internet issues. So I think what I was saying, I'll start for the slide, that although it looks like Catron and DeBaca have the highest rates, that may be because of a small number of deaths, which matter, but even like a single death in DeBaca County could lead to a large rate like the one you're seeing here. That may be meaningful statistically, but the reason I'm putting these confidence intervals here is because they're helpful in estimating the odds that this number could have happened by random chance from year to year. And really, there aren't many statistically significant differences on this page. You'll see a really small confidence interval. That's this little line that's over the orange bar for Bernalillo County, and that's because it has the biggest population. And so we have a higher degree of confidence about the number. There are ways to get more precise answers to a question about overtime by either combining years or doing like a more complex analysis, which I'm interested in doing if people would like to learn more about their community. But just wanting to share this because I sometimes feel like people are tempted to look at the smallest and biggest bar and say that was the worst county and that was the best county. And that is not always the case in how these are presented. And I think it's just a little trickier to explain, but would encourage people to reach out if they want to understand better for their own community what we think is going on. So this is a line chart just showing over time deaths in New Mexico by suicide. Overall, since 1999, the rate has increased about 34%. Most of that increase you can see is from around 2009 to 2018. It steadily increased over a period of about 10 years. And then it remained flat from about 2019 to 2022. And then we had that 1 year drop in 23, and then it returned to the rates from those previous years in 2024. I'm going to highlight some specific views similar to this, but for subpopulations. So looking at women, we see that the rate of suicide has actually been much flatter over time, or particularly from 2014 to 2024. With a substantial drop in 2023 and 2023, the suicide rate for females is actually something like 40% lower than it had been the previous year. But it returned to a similar rate to what it was 2 years prior. This is just a chart showing American Indian and Alaska Native suicide deaths in New Mexico across the same time period. Unlike the female chart, the rate dropped from 2022 to 2023, and that was a statistically significant drop, also about a 30 or 40% drop. And it did increase in 2024, but it did not return to the 2-year high back in 2022. And the drop from 2022 to 2023 was a statistically significant drop. It's worth mentioning that American Indian and Alaska Native suicide deaths are still, while the rate is not significantly higher than other groups, it is a higher rate than the other groups. Sorry, I feel like I'm getting a little too in the weeds with some of the statistical stuff today, so bear with me, not sure why my head's there. For Hispanic males, I'm including a chart because we did see actually an increase in Hispanic male suicide deaths in 2023 and a similarly high rate in 2024. 2023 was the highest rate of Hispanic male death in New Mexico on record from going back to 1999. And so I think this is another area to sort of watch and pay attention to. I think even, well, yeah, so I just am concerned about that, partly because the Hispanic male and female population had traditionally been one of the lower risk groups in New Mexico. So I think I'd be interested to hear from the audience or other people about, what they sense might be going on or changes in that community. I also want to talk a little bit about changes over time by age group. So this slide is a slide that I share in any mental health presentation I do, and I do think there's some important information here about youth. And by youth, I mean those kids who are still school age, teenagers aged 11 to 17. So there's a couple things to talk about on this chart. So I'm not just including suicide, I'm sharing motor vehicle and traffic deaths in New Mexico. One thing that I'd like to point out is that motor vehicle and traffic deaths were by far the leading cause of death of teenagers in like 25 years ago in 1999 to 2003. But due to the success of like consistent public health efforts in multiple ways, we've seen the rate of motor vehicle and traffic deaths decrease over 50% among adolescents in the last 25 years. I'd like to just pause on that and really point it out, because I think people will say, especially in suicide, they'll talk about it as if prevention doesn't work or there's nothing that could happen. But the reality is there's a lot of good evidence and data that shows public health interventions, including around injury deaths, works and can save lives. And that we can really help people make informed choices about their own safety, around how they approach risky situations, and how we can make the built environment safer to decrease the risk. And a lot of those same strategies that are in motor vehicles, a similar type of strategy can be considered in suicide. The next thing to point out on this slide is a window of time where youth suicide deaths really increased in New Mexico. And also, I think nationally during the same window. We will also see in some future slides that there's a similar risk of increased mental health concern during this window. But from sort of that 2012 to 2021 period, there was a steady increase in youth suicide death in New Mexico, increasing almost 70% over a 7 or 8 year period, which is very concerning. And we saw similar outcomes around measures of sadness or hopelessness during the same window. I'd also like to point out that people often talk about COVID and the impact of the pandemic on mental health of young people. We did see a particularly high rate of peaking around 2018, 2019, but continuing through 2020 and 2021. But this trend really began in years before the pandemic, and some of the largest growth was actually in those few years right before. But the other thing that I'm sort of excited to talk about and share is we now have, I think, 4 consecutive years where the youth suicide rate is really approaching the numbers it was 10, 15 years ago. So now the most recent 5-year rate of 2020 and 24 was 9 deaths per 100,000, which is still higher than 7.5 where it was 25 years ago. But I would say this is actually a true trend moving in the direction of a decrease. However, suicide still remains a leading cause of death for these adolescents. And I'd also point out that, when we talk about these young adults, these kids who used to be kids in 2016, 2017, 28, those are now the young adults in that 18 to 34 range where we're seeing higher risk of death. And there might be like a cohort effect with this group that is worth us tracking, but also thinking about prevention strategies and how their needs might be different than others. Okay, I'm going to take a quick pause and glance at the chat. Okay, and then I'll keep moving and do a time. And just want to make sure we stop maybe 15 minutes early. I want to talk about firearms and youth suicide. Like all deaths in New Mexico, most youth suicide deaths involve a discharge of a firearm, including very young children. There were 8 children under the age of 13 who died from the discharge of a firearm in a suicide death. I think this is important to mention because actually, particularly with younger children, there is a question of, do people have access to the lethal means to end their lives? And when I participated in child fatality review boards, it was often reported that the parent didn't see their child's at risks. And so they may not have put enough safety barriers in place to prevent the death. And I believe those parents that they did not anticipate or see the risk. But I think recognizing that young people are all at risk of an emotional mental health crisis, it's sort of a normal part of youth development, and that firearms are very dangerous. And I do really think there's opportunity and benefit to prevention, at least ensuring that these young children don't have good access to those outcomes, or that they have the right training or exposures to prevent risk of a suicide death. I just know that these deaths, like all suicide deaths, have a ripple through our community. We also know from our youth survey data that about 40% of kids know there's a gun in their household. And about 1 in 125 kids report that they brought a firearm on school property. And when kids report bringing a firearm on school property, those kids were much more likely to have been kids who also had attempted suicide. There's some really good research, I believe, out of Minnesota on the relationship of sort of suicide attempts and suicide ideation with shootings at schools. Many people who engage in those behaviors are also attempting suicide or die by suicide in the events. So just thinking about comprehensive suicide prevention is also a form of violence prevention and the opportunities there. And just also recognizing, again, the community burden these events hold on all of us. So one more highlight on age is this sort of 18 to 44, which is, I don't know if that's entirely younger adults, but this group has really grown in its risk for suicide deaths over the last 25 years. The rate has increased 41%. More than half of suicide deaths are in this age range. And about 20% of these deaths were among adults aged 24 to 34. So just again, kind of harping on it, but seeing some trending towards younger adults in recent years of data. Okay, so I'm going to kind of pivot from just the raw death statistics to talking about general mental health in New Mexico. Before I do that, are there any questions about what was just shared about sort of the state of suicide death in New Mexico and those recent statistics I just shared that people have on their minds? And you can unmute or put it in the chat. Yeah.
Dylan,
Go ahead.
this is Jessica Strong from Los Alamos County Social Services Manager. Can I ask a question about the stats on slide 8? Are those,
Sure.
when you were talking through the kind of confidence intervals, are those numbers the actual numbers, like 20 suicide deaths in Los Alamos County, or are they an estimation based on 100,000 population? Does that make sense?
Yes, I can answer that question. So we can provide you with the actual count of suicide deaths if you're looking for that. That data is also available. This chart is showing a rate of deaths per 100,000 residents, and it's age adjusted. So it's actually weighted based on how many older or younger people are in that county.
Cool.
So this is not the true count. It's a rate per 100,000, and I'm almost positive that, well, you might know, but so, if your county has 100,000 residents, this would be very close to the count before adjustment. But if your county is smaller than 100,000 people, like half as small, then the count would probably be half the number on here. Is one way of kind of doing head math if you were trying to guess it. But you can also send me an email and I can tell you the actual count or provide you
Thank you.
with that information.
I appreciate the explanation. That's great. Thank you.
Yep.
Dylan, Felicia. Oh, I'm sorry.
Yeah, go ahead.
Felicia
Hey,
has a
Dylan.
question as well.
Thank you. Yeah, I was wondering, you had said, which slide with this? You had said that there was a cohort, like a potential cohort effect, but I missed what cohort that was.
Yeah, so I'm thinking, let me go to that slide for youth. So this is me sharing what's in my mind, but you can see here that these were kids who were age 11 to 17 in the years of like 2014 to 2020. And so those kids are probably now 18 to 22-ish because they've aged since the time of these data points. And it happens to be that we're now seeing higher rates of death among kids or young adults aged 18 to 24. And so when I look at this youth chart and then see in our adult death data that younger adults are now dying, it looks like the risk might be being carrying with that same group of people, just as they're moving into a different age demographic. Does that make sense?
Yeah, that's very interesting. Thank you.
Yeah, and somebody at UNM had pointed out we did this. We've often shared that like high school students have been reporting about 1 in 10 reporting a suicide attempt. And then we've noticed in our adult telephone survey like a much lower rate of suicide attempt reporting. However, once we looked at it by actual age, the adults who are aged like 18 to 24 are also reporting about 1 in 10 of them reporting a suicide attempt. And so the adult telephone survey is kind of consistent with the high school data as long as you look at it by age. It's only the older adults who are reporting much lower rates of suicide attempts.
Thank you.
Yeah, okay. I think that was it. Okay. So I'm gonna go into sort of like contextualizing mental health broadly. As a mental health epidemiologist, there are actually a lot of things that contribute to suicide risk, not just mental health outcomes, but I'd like to talk about how mental health might be a factor and what we know in New Mexico on this topic. And also think about suicide prevention as having opportunities well before a person is thinking about suicide, when they're beginning to have mental health symptoms or mental health concerns, and recognizing that those other contexts and opportunities for suicide prevention. So what's on this slide is, it's kind of a weird slide to look at, but there's a bar chart going to the left and a bar chart going to the right. If it's an orange bar going to the left, what it's telling you is that a rate of a leading cause of death in New Mexico has decreased from 1999 to 2023. So for example, for heart disease, New Mexicans are now 28% less likely to die of heart disease than they were in 1999. If a bar is on the right side and increasing, it's showing that that is now an increased likely cause of death for New Mexicans. So unintentional injuries, which include drug overdoses, have increased 80% in the last 24 years. Chronic liver disease has more than doubled, which also is associated in part with alcohol consumption. Alzheimer's disease, which I consider associated with mental health, and suicide have increased. The reason I'm highlighting this slide is because I think outside of just suicide prevention, that suicide and behavioral health will become a growing area of public health interest as these leading causes of death and growing causes of death continue to be associated with behavioral, like social factors. And so I expect sort of until this pattern changes that we'll keep having more and more interest in these areas as a health topic. And yeah, most of the increase in unintentional injury deaths has been due to the increase in drug poisoning or overdose deaths, which have are almost 4 times higher than they were in 1999. I mentioned earlier when we were looking at those youth suicide death increases that we had seen a similar pattern in our measures of mental health. From 2003 to about 2013, whenever we surveyed around persistent feelings of sadness or hopelessness, about 1 in 3 students responded as having that concern. And then from 2013 to 2021, really that same window as we saw an increase in suicide death, we saw year-over-year increases in risk for sadness or hopelessness. Like in suicide death, we also saw a 1-year drop in 2023 in this measure. We just finished data collection in the 2025 YRS, but we don't have the data back to report yet. And that should be available in maybe 5 or 6 months. So we'll see if this chart sort of mirrors what we see in death data also, where that number either goes up or stays down. We'll find out. Yeah, so I had some notes that I didn't highlight, but here we are. some research. So I wanted to highlight some work we did in the last year since the last time I shared data. We did some analysis that we had shared at a national conference about the risk of drug overdose, suicide, and alcohol-related causes of death, and some particularly on suicide related to education attainment. So in New Mexico, an adult who finished their bachelor's degree was 80% less likely to have died due to a drug overdose, suicide, or alcohol-related cause of death than an adult who did not finish high school or attain a GED. And that drop from when an adult goes from getting an associate's to a bachelor's is like by far the largest jump in the decrease for risk. But even getting to some college was also associated with a decrease in risk that was actually almost half the risk of just getting through high school. I think there's a lot of good evidence in our data that economic and educational factors are closely tied to risk for these outcomes. Looking at occupation particularly, we saw that adults who work in construction and extraction occupations were about 15 times as likely to die of a drug overdose or alcohol-induced cause or suicide-related cause than those in education, training, and library occupations. And it's something like 11 or 15% of all suicide deaths were among people working in construction and extraction occupations in New Mexico, which is very disproportionate to their actual number of people working in those areas. I think this is a really important area for prevention activities. I know that I do a lot of presentations with people working in education, training, and library occupations, or people working in healthcare practitioners. And I occasionally do them in some of these other areas, but I don't know that I'm doing enough work that's really communicating about these needs to the groups that are most at risk. Another thing we learned from that study is that some groups are at much higher risk now than they used to be. So the second highest group of like food preparation and serving related occupations did not used to be one of the highest risk groups for suicide, but is in recent years become one of the highest risk groups. We're also seeing a high increase in caregivers and people who do that type of healthcare caregiving type work, not necessarily the doctors, but the in-home healthcare type workers, which may also reflect changes in sort of like how those jobs work and economic changes in the last decade or two. We always talk about this. I think there's a real interest in thinking of youth mental health as particularly a public health crisis or a serious mental health issue. In 2022 and 3 and in 4 also, the CDC and the Surgeon General put out a number of reports on these topics. There are a couple of really interesting ones. The US Surgeon General in 2024 put out a report on the mental health of parents, noting that like parent mental health is really a major concern and impacts all levels of society. He also issued one about connectedness and its impact on overall health in the United States. I think those are really good resources for thinking about some of the interconnected factors that drive these outcomes. And also thinking about how our society has sort of changed and how we connect and communicate. I mean, I think 10 years ago, this meeting would have only been an in-person meeting, and there's benefits to being online. I get to talk to people from across the state who wouldn't normally be here, but the way we connect has really changed. I just want to highlight some things that we can show and use in our data to help explore questions differently. I've shared some version of the slide in most presentations, so some of you may have seen it before. What it's showing here is this is emergency room data. And in the month of August in 2023, the number of suicide-related emergency room visits, that means they were diagnosed with either a suicide attempt or suicide ideation, more than doubled in August for adolescent girls or girls aged 5 to 17. Does any, and if you remember the answer, you can say in the chat, but does anyone have a guess like what was going on in August of 2023 that might be associated with an increase during that window of time? Yeah, so that's when kids return to school, typically in New Mexico around August. And then if we look forward, this is the next year, same exact thing happened in August of 2024 that happened in August of 2023. And I didn't include it in this deck, but it actually happened again in August of 2025. And actually, I think in 2025, it was the steepest curve of all of the years that we had. This kind of emerged from a project we did with CDC. They wrote a report on this, but during the pandemic, we were asked to look at seasonal effects of, especially related to in school time and mental health events. And we really saw that in those weeks and months when kids are returning to school settings, that their risk for both suicide death and suicide attempts increased substantially. And I think this is an important data point to just, think about the importance of sort of like major transitions and even like positive events that could be stressful on how it might increase risk for a mental health crisis. And planning around resources and maybe doing preventative or universal mental health approaches during those weeks when we know there's increased risk. We do release a quarterly mental health report, and we try to highlight if there are notable changes. One other thing I sometimes share in these is sort of just to dispel a rumor that, the holiday season around Christmas is not the highest risk time for suicide death. It's actually among the lowest risk months or weeks for both adults and youth, both in New Mexico and nationally. That doesn't mean that they don't happen during that time. And we think probably what's happening is that when someone does die on a specific holiday, people are very likely to like remember the specific day and have an association with it and talk about it, which I think is normal and human, but that may be where some of that popular belief comes from, but it's not in the data.
Dylan?
Yes.
Susan has a question, and I just wanted to let you know you have 14 minutes to
Okay, thank you.
11 o'clock. Thanks.
Okay, go ahead, Susan.
I had to get off of mute. Thank you, Carol, and I'll be quick. And Dylan, and as far as the research, were there recommendations made to intervene on the data, on those data for return to school?
Yes. And I could probably pull exactly what's from the weekly mortality and morbidity weekly report. A lot of it was around encouraging the known social emotional learning type programs that have been evidence-based to reduce risk for children of mental health crises generally. I think the other recommendation is to ensure that school administrators, superintendents, and others know that these periods of time are at greater risk, so that they might consider implementing, strategies or notices to people to be more aware and offer more services during those times. The other strategy that's been recommended for that age group is the U.S. Preventative Task Force, which is like a federally funded research group for prevention measures, has recommended universal screening for both anxiety and depression for school-aged youth, knowing so that basically to try and check in with youth and detect the symptoms of a mental health issue before it becomes a crisis, so that they can get maybe a linkage to a school-based health center or community-based support, and where a lower level of intervention might be really helpful. And those are the recommendations we have there. The U.S. Surgeon General report on the youth mental health crisis has recommendations for like all levels of society. They have like recommendations for what children can do themselves, for what parents can do themselves, for what schools can do, for what government can do, and for what healthcare can do. And for people who want kind of a more comprehensive answer, I usually send them to that report.
Thank you. Can you send that report to the Office of School and Adolescent Health? You can send it, and then I can funnel it through our team.
Yeah, absolutely. And I'll point out that those reports are worth reading because they talk about things that are less obvious but make total sense. And so an example that I remember from that is they talk about how the teacher to student classroom ratio is an important mental health consideration, because if teachers have a more reasonable student classroom ratio, they're more likely to spend like individual time with a student where they could like learn more about the individual needs and health of the child. But that's sometimes different than I think just talking about like more therapists or more clinical services, but about sort of enhancing the adult-child relationships in those settings. But I wouldn't have thought about that had not read that report. So I'll send them, and yeah, I'll send it to you, Sonia. Yeah. How about this? I sent the slides to Carolyn. Is it okay if I send you some resources, Carolyn, and then maybe we can share them with the slides when they go out? Okay. Let's do that. Okay, so I'm on a slide about non-suicidal self-harm. So we ask kids if they hurt themselves like by cutting or burning without actually wanting to die. About one, let's see if I put a note. Yeah, I did. About 1 in every 5 students reports it's engaging in non-suicidal self-harm. This is a common risk behavior, and I guess for context, it's say like twice as common as binge drinking among students in New Mexico. However, most students who report self-harm did not also engage in a suicide attempt. In fact, 2/3 did not. But I would say is that if a child reports non-suicidal self-harm, they are at much greater risk of having attempted suicide than those who did not. So actually 14 times more likely. I say this because at times we've had some discussion or conversation about like, well, if someone says they cut, should you treat them as a suicidal child? Well, probably not. But is it worth asking them a question about if they thought about suicide? Well, probably yes. And most kids will say no, but about 1 in 3 would say yes. And that might be a good opportunity to then ask the question and then do the kind of training or resources that come from the QPR gatekeeper training or the other types of suicide prevention gatekeeper trainings that we have available. And this is also just showing some of the trends in non-suicidal self-injury. Something that we thought was interesting is in 2021, there was an increase in the number of high school female students who reported self-harm, which did not happen for male students. I often show our charts stratified by male and female, and that's because there are real differences in mental health outcomes in our data consistently by these groupings. We often don't see major differences in these mental health measures by race, ethnicity, or some other demographic factors, but there's always big differences by male and female. Worth mentioning too that although suicide attempts and non-suicidal self-injury are much more common among adolescent girls, the risk of death is much higher among boys. And we don't just see that in survey data, we see that in our emergency room data. We see more suicide attempt visits for girls than boys. And so there's a lot to kind of take in with that. One is we believe or know that boys are more likely to attempt suicide with a mechanism that's likely to be deadly. And that when they do make an attempt, again, they're choosing those mechanisms, but there might be a whole sort of different prevention strategy that would be appropriate for boys than girls too, recognizing the different risks. Lastly, there's a lot of attention to the relationship of social media and mental health in New Mexico. We started asking questions about social media for the first time in 2023 in our high school survey. The main thing I want to point out here is that 80% of students report they're using social media several times a day or more frequently, and that those students who report that level of use are at higher risk of all of our mental health outcomes than the students who do not use it at that rate. I know there's a lot of work on this topic in the last year or two. I know at the Roundhouse, there's a bill this year about screen time in students and screen time in the school setting. Last year, there was a bill about locking up cell phones and protecting students from online experiences in classrooms. Also, a couple of years ago, there weren't many like rules or protections around students with social media access in schools. And now when I talk to people, it seems like near ubiquitous that schools have adopted some plan or program around how they restrict online access at schools. I will say that's kind of like a big experiment on young people in terms of like what type of interventions are most appropriate and what public health recommendations are best for social media use and mental health. And it's sort of a growing area of study and I think needed knowledge for all of us. So I think I just have a couple more slides. Just want to talk about New Mexico in particular. Among adults in New Mexico, about 1 in 3 New Mexico adults report being socially isolated or lonely. In 2022, when they asked the special module that asked about loneliness, New Mexico had the highest prevalence of loneliness of all the states that asked the question. And I just think that might be one of the factors that also makes a state like New Mexico different than other states, and thinking about risk and where there's opportunity for change, thinking about how adults or young people are isolated. Looking at Atlanta specifically, 90% of adults who report considering suicide were also adults who were socially isolated or lonely. And they were, about 9 times more likely to have reported a suicide attempt than others. So last thing I just want to share is like where we're going with this and how we're thinking about data and improving it, using it to help New Mexicans. This sort of data can be used to promote better prevention efforts. We can improve our data collection. So I think one thing that we get a lot of questions about, which I am self-conscious of, is like, it'd be nice to give you some preliminary data about what's going on in 2025, because I know a lot of what we share feels like it's already out of date. But building that kind of data infrastructure requires a lot more systems, investment, and partnership. But it's worth it, because if we have near real-time data, then we can do better and more responsive outcomes, and people can actually use the data to help their communities in different ways than we're doing now. But I think the CDC is adopting an approach to think about mental health as a similar health topic as they thought about infectious disease, which is really radical for them. In the past, they've really not treated mental health as like a major public health issue requiring like a primary, secondary, and tertiary prevention. So for example, in oral health, everyone knows to brush their teeth, and we have these universal strategies, but we just don't necessarily push the same kind of universal mental health prevention strategies that we do in other health topics. I put the link to get some of our mental health data in the chat, so hopefully if you joined, you can get it from there. We do have reports on that link for long reports that have like county level views on things like comorbid substance use and mental health. I do encourage people to reach out and you can do your own data request, tell me what you're looking for, and we'll provide you the data you need. And I think that's probably one of the better services we offer. These general reports can be really helpful, but we do have data on specific counties and communities. We just often don't share them in these statewide presentations, so reach out to get that. This is where you are right now. I put this in every presentation. I'm trying to send people your way. I think this is a really important group, and I've been so impressed with everything you do. And I'll stop there, and I think I have a few minutes for questions if there are any general questions or feedback.
Hi, this is Sonia with the Public Education Department. No questions or feedback. I mean, the feedback is this is incredibly helpful and thoughtful, and I just wanted to thank you and just drop a little seed about mental health literacy. One of the last things that you said about how we teach people how to care for themselves physically, such as teeth care, dental care, that I love that analogy that you use. There is a growing curriculum and support from the Mental Health Literacy Coalition, or their state, they gather states across the nation. Anyway, I'm a part of it. Please reach out if you all want to know anything more about mental health literacy. It's one of the things that we're trying to promote and get in our schools through Safe and Healthy Schools Bureau. Thank you, Dylan.
Thank you. Yeah, if people don't know Sonia, she's a real champion of our young people, and I think moving the dial on mental health in New Mexico. I think it's the same for like Susan and our Office of School Health. There are a lot of people here who are really changing the narrative on how we talk about mental health. I do feel like when I started a little bit over 5 years ago, it was harder to find examples, but now it's true. Like people are really not just piloting, but really rolling out these programs. Yeah. Okay, well, I really appreciate all of you, and I just hope you keep up the good work and getting wins for our state. Yeah, go ahead.
Yeah, I'm wondering, I appreciate all the data, especially on the youth that you present and do. Do you have any data or access to any around youth and Google searches in conjunction with suicide?
So I'm not a steward of any data. Like I don't hold a data set that probably answers questions well about that. Like in terms of some things we could try. So we could do like a search of emergency room data to see if in the chief complaint or triage notes, the doctor entered something about that. I have shared and tried to read and follow some of the national reporting on this issue. I guess for people who may or may not know here, there have been websites and forums where they're like explicitly teaching or communicating how to die by suicide to young people or adults, and in some ways like supporting people and actually following through those tasks. And I try to keep track of it as best I can, even though it's very disturbing to like follow those websites. The other thing I do is I do watch. I think there's a chemical called sodium nitrate. I want to say it's sodium nitrate. I might be wrong, but it's a weird chemical that has no regular use. Like it's used to like dry meats for jerky or something, but it can be used in a suicide attempt. And I see that as like I try to follow the deaths that are related to that because people would probably only become aware of it due to like an online thing or some sort of like social communication thing. In some states, like Colorado, have tried to consider like banning easy access to those substances for that reason. But other than sort of tracking mechanisms to look for things that might be related to online or social activities, I guess not enough. But that's a really good question. And I don't know if you had something in your mind other than what I talked about. If so, maybe we can start surveilling.
I was just thinking about really big data sets and what youth are doing in terms of, Google searches are going to probably speak to people's truth more than how they answer a survey. I mean, there's good data to show that. I just wondered if you had any familiarity with that, but thank you. I really appreciate your presentation very much.
Thank you all.
Thank you, Dylan. We so appreciate you. If we could take a 10-minute bio break, we'll meet back here at 11:10. Thanks. Don't leave us. We are back. So, Paul or Kate, if you would like to talk to us a little bit about the budget update, we'd sure appreciate it.
So I'm going to go ahead and take that. You can hear me okay?
Yep.
Good, good. We have been doing some work with some outreach efforts. We started out with this year's fiscal budget at about 25,000. We're a little less than half of that left, but that does not include the costs for doing the outreach today at the Roundhouse. So we do have some funding left to do some outreach efforts. Clary told me that she had a conversation yesterday with a school that they may want to do a suicide prevention day, which will count for one of our outreach efforts. So the idea is just to get the word out there in the community and get some awareness or some initiatives going that can help in suicide prevention efforts for whatever target population that your work group might be working with. So you can always reach out to me or to Carolyn or to Clary or to Kate if there's any ideas. We don't have unlimited funding, unfortunately, but we do have some that we can do some efforts. So please let us know. We are also working on the budget for next fiscal year, which will start in July. And we've already got some thoughts about that as well. So that's about it for the budget. Thanks.
Thanks, Paul. I think moving on with the agenda. So upcoming 2026 meeting topics. Carolyn, please correct me if I'm wrong. I think we're just taking a call for those. We'd like some suggestions from our coalition members. Anything that you would like to hear during 2026, any suggestions that you have, anyone that you might have in your network that would be ideal to present to the coalition, etc. Am I correct on that, Carolyn? I see you nodding your head. Okay, good. So please reach out to Carolyn, myself, Paul. Let us know what your ideas are, or whom you may have again to connect us with. We'd like to make sure that our quarterly meetings are filled with topics that are good and bring us all some good information. Call for work group facilitators. So we do have a couple of work groups that currently do not have leadership in place or facilitators, if you will, in place. Those groups include communication and messaging. It looks like we've got legislation and policy, primary care and healthcare. That we're looking for some individuals to step into those roles. We're more than happy to meet with you and explain what that entails. If you're already a part of those work groups and have been for a long period of time or even a short period of time and you have interest in leading those, please let us know. We would really like to get those spots filled so we can carry on with the good work that these work groups are doing. Future leadership. Yeah,
Kate,
sorry, Paul.
Just real quick, I was notified today as Wendy Linebrick Allison showed up. She is going to step back into the role as facilitating the legislative and policy group. She says she's missed it, and she really has a really keen eye for it and a lot of knowledge base, and so she's going to step into that role.
Excellent. Thank you for that. And thank you very much, Wendy, for doing that. Before I move on from those work groups too, if you have any interest in joining any of our work groups, please, the more people, the better. So as we go through the updates here in just a few minutes, if you hear some updates, some things that, really make you feel like you would like to be a part of those groups, please let us know. We'd love to have more individuals within those work groups. Future leadership, you may recall that during our last quarterly meeting, we discussed where we're at with our coalition leadership. So Paul has been our chair for almost 2 years now. I think October he comes up on his 2-year mark, which means that that position would roll over to the chair-elect, which currently is me because I stepped in to fill that place when we didn't get any nominations or interest. So we want to put that back out there again. Anyone interested in a leadership role in the coalition, please reach out to us. I can say from the years that I've been a part of this, and a part of the coalition as well as being a part of leadership positions, this is a very, very gratifying role to be in, to be able to come together with all of you every single quarter, as well as to get to do the behind the scenes work. And so I encourage any of you that might even have a slight bit of interest to reach out to us and let us talk with you about what that looks like. And what is involved in that, because we would love to see some strong leadership move in, following Paul's into being chair. And as it sits right now, it looks like I'll roll into chair again, and that's not really how we wrote the guidelines or the way that we wanted this to go. We'd really like to see some new thought, I think, come in. I think Paul can agree with that. I think it would be really good to have some new individuals or experiences or you name it, step into these roles. So please reach out to us and let us know if you have any interest.
Kate. I'd like to just mention something about that as well. And Kate and I have had this conversation that we just don't want it to sit there and go back and forth between Kate and myself. We've had our turn at the helm of this organization, and I think we've accomplished some incredible things in the past 6 years now. And so we just want some new blood in here that can take this in. I don't plan on stepping away from the coalition. But I think it's time for somebody else to drive the boat. So let us know. It's a great opportunity. It's not a ton of extra work. Carolyn and Clary at the state have done an amazing job to keep this moving and help with the logistics. So there's really not, a lot of hands-on. So please let us know. Again, you have our contact information. Just reach out to us. Thanks. Sorry about that.
No. Thank you. And then suggestions for future topic speakers. I already kind of rolled that into the second bullet. So I don't think, unless I'm forgetting something, Carolyn, with that, I think I rolled those two topics together. And so for our agenda now, we've got our work group reports or updates. Paul, do you know if we have any updates with communication and messaging?
As far as I know, we still don't have anybody in that role. And I also forgot to mention that Desiree also reached out to me and is stepping away from leading the faith groups, the faith communities group. She's just got a lot on her plate. And so we're looking for somebody to take that role as well. And so I've been kind of talking it up here at the Roundhouse to get some interest in taking some of those leads for the work groups.
Excellent. Thank you, Paul. How about our firearm violence prevention? Miranda, are you on to give an update? I think that was a long pause for me to see if she's on. I'm not sure. Carolyn, do you see her?
No, but is Justin not on?
Justin, are you on?
Because I think he's got a conference coming up.
So I can speak to that since I'm still kind of involved in the first responder group as well. So Justin's got a first responder mental health conference, crisis conference happening in Clovis. I'm looking on my calendar really quick. It is at the end of February. So I
25th and
believe.
28th.
Oh, so Justin, are you on?
Yeah, I was trying to
awesome.
figure out
I'll
which
let you
mic
take
and
it
which
then.
camera. No, you're fine. Like,
Okay, go
I
ahead.
don't
I'll
ever know
let
what's
you
going
take it.
well, I mean, you're going to be there too, so you're. So yeah, we have a crisis and mental health conference for first responders that'll be put on. The pre-conference reception is the night of the 25th, and then it's a 3-day conference for the 26th, 27th, and 28th, and it'll cover topics on crisis and suicide intervention and prevention, like actually in their role as a first responder. And then it's very heavy on the wellness and suicide prevention for first responders themselves because of the trauma that they view and experience in their role. So it'll cover things that are specific to someone who's firsthand experiencing that. There's some that are more focused on leadership, creating a culture that is helpful in being able to address the trauma that's seen instead of saying just don't talk about it and shove it down. And then there's several presentations that either in breakout rooms or the main room that will cover like the creation of first responder peer-to-peer groups to address trauma and suicide prevention and intervention for first responders.
Excellent. Thank you so much for that update, Justin. Does anyone have any questions about that upcoming event?
And as a side note, we don't have, really it's me and Paul is the first responder work group at this point. My hope is at this, it's free attendance. So we have people from literally all over New Mexico that are coming at this point. And so our hope is that we can get some of the actual first responders that attend the conference to then join the coalition and the work group. But if anybody here wants to join, let me know.
Looks like we have a hand up. Emily?
Yeah, I was just wondering, I'm so sorry, I'm a bit new to this, but I'm wondering if there's going to be an announcement going out about that event. I certainly would be happy to promote some of that if you're looking for people to attend. Yeah, if there's going to be just that there's going to be an overall message about when that event is and whatnot.
So we've sent it out through our first responder, like to every police department, every fire department. But if you want me to, I can send that out to the whole coalition as well.
Justin, would you like to put the link in the chat?
Sure, I can talk.
Thank you.
All right, thank you. Any other questions? Emily, did you have any follow-up question to that or?
Nope, that was it. Thank you.
All right, thank you for your question. Okay, Marvel.
Yeah, Kate, Justin, will that be streamed at all? Can people access it outside of physically being there?
No, it'll just be in person.
Thank you.
All right, any other questions? Okay, so again, our legislation and policy work group, we are looking for members for that. So no updates at this time. Our Native American and American Indian work group, Teresa or Tony, are you on the call today to give us, or in the meeting today to give us an update on what the work group has been working on?
Hi, good morning, everyone. I'm here on the meeting. So we don't have specific updates since the last quarter. We lost a little momentum over the winter months, but we're in the process of scheduling our next in-person meeting. So folks who are on the email list for that work group, stay tuned for updates in the near future. If you want to join that email list, please reach out to me. you can send me a message, or I'll put my email in the chat. And then lastly, we have some upcoming trainings here in Albuquerque. If folks are interested in attending a Safe Talk training or an Assist training, reach out to me and I can get you that information as well. Thank you. That's it for me.
Thank you so much, Tony. Primary care, healthcare, we do not, we don't have leadership in that group yet. Again, another reminder, if anyone is interested, please reach out to us and let us know. How about school youth serving organizations? Regina, are you with us today?
Yes, I am. Good morning, everyone. So we have not been very active, unfortunately, over this last quarter. So we are still looking for a co-chair to help. I know Carolyn helps out. So anybody who'd be willing to step in as a co-chair for this group. I am looking specifically, as you know, I work with Department of Health. And I would really like this group to be led by someone, for example, representing a school district or a youth serving organization, so that we can have that valuable input. So that's just my pitch out there today. If anybody's interested, I promise you won't have to do a lot of work. I will take the lead, but definitely looking for someone who can help and assist with that. So other than that, we do meet on a monthly basis. Our next meeting, let me double check that schedule, is February 11th. I will put my email address in the chat box. If you're not on that mail or listserv, then just send me a message, an email, and I will add you to that, and I will send you that meeting link. So we meet the February 11th at 3:30. Thank you.
Thank you so much for that update. Okay, Veterans Military Reserves, is Valentina on the call with us today for an update, to provide an update?
I know that Valentina is here at the Roundhouse, but she may not be logged on.
Okay, all right. Well, we'll look for an update from her in the next quarterly meeting. How about our LGBTQ plus? Abe, are you here to give us an update?
Hey, yes, I'm here. So I'm kind of new to this role, and I joined last year. I had gotten in contact with some different queer organizations. I work for the Transgender Resource Center as well as Breaking the Silence. And I am also volunteering with a few other nonprofits who do like just a lot of social work and outreach to the unhoused population. So yeah, my work gives me access and opportunity to be involved with it and network with a lot of people in a lot of spaces. So I've been just kind of conversing with people. I did want to try to do an event for queer mental health that did highlight like suicide prevention and awareness last year, but I didn't get approved for the funding. So I'm gonna just like readjust my proposal, and I had a meeting with Eric and Adrian, the co-directors from TGRC, and just got a little bit more insight on what to do and how to pitch all of this stuff. So hopefully this year that goes through, and we have an event that has queer focused mental health, as well as, because I'm Chicano, and I know last year with the all the stats and stuff, the Hispanic had risen with suicide rates, but now it seems like it's gone down, which is awesome. But I think with like the current administration and everything that's going on in the world, things might be looking kind of weary for us. So I also want to focus on that too, just with my own story and all of that. But I do want to thank and shout out Tony for his presentation with the last quarter meeting, because what he was saying that his work group does, and I want to join your work group too, by the way, I'll be reaching out soon. But all of the stuff that y'all do, like that's just something to aspire to within a work group, because y'all do a lot. That was really cool what you said y'all did. But yeah, that's just my update. So moving forward, I created my own flyer for the queer work group. So I'm going to try to like start handing that out and just get more involved in networking to try to get this going.
Perfect. Thank you so much, Abe. That's great. Let us know if we can support you or help you in any way as you get that work group going. We'd be more than happy to be here for you. All right, excellent. That is our updates for our work groups. Again, we are looking for leadership in the communication and messaging, and just a little bit of explanation on what that work group is. So and Carolyn, you may need to step in a little to help me, or Paul. This is really going to be a lot of the, our Suicide Prevention Coalition's website, use of our social media. So I believe Instagram, Facebook, correct, Carolyn? So it's really going to be managing stuff like that, putting out information, resources. So if any of you in the coalition are interested in those types of activities, please reach out to us, because we do need somebody to take on that role.
And Kate and Paul
yes.
are great guides. They will lead you along the way. Thank
I
you.
think we try to be. Thank you, Carolyn. Then the other one, primary care and healthcare again. That one we do need to fill. That we've really struggled with that work group for, I think, probably upwards of a couple years now. So if there is any interest, please reach out to us in that. And okay, moving on in our agenda. So it looks like we've got coalition member announcements and resource sharing. I know that Stephanie is going to give us an update on the Taos Gorge Bridge. Stephanie, are you on the meeting?
She's going to hop onto my computer here.
Okay.
Thank you.
Hello. Hello.
Stephanie, we can hear you.
Oh, okay. Hey, so did you guys just want a bridge update? Okay. I met with Ricky Cerna last week, and he has committed to having a team of engineers who have already started designing the railings for the bridge. That's a 4 to 5 month project. They also are tearing up the concrete that already exists on the sidewalks there in order to make the bridge more weight bearing for the new railings. He originally said this is going to be done by July, but what it really means is that the plans may be finished by July, and then the concrete remediation, and then the painting of the bridge will take place right after that. So we're looking at something like this time next year, maybe, or hopefully October, because there are a lot of weather issues with the railings. But they've committed, the budget's there, and it's moving forward. We're going to be creating a repository website that will track the DOT and the HCA interactions and the timeline for the bridge railings, along with the security issues or patrol issues that we're trying to work with. One of the call boxes was wrapped. It's really nice. And they're planning on cleaning up and wrapping the remaining 10. And that's kind of it right now. Did you guys have any questions or?
This is Michelle Roque. Can you guys hear me?
Yes, we can hear you.
I can hear you.
Okay, great. I had a question. So I'm from Taos. I'm with Rocky Mountain Youth Corps, and this past Wednesday I attended a DWI council at the courthouse, and there is a couple of us there that are wondering if we can take like a letter to legislation or the legislation session, and maybe it's too late because they're already in session, but do you know anything that would help with things at the Gorge Bridge as far as like taking it to the legislation? Just wondering.
So this legislature doesn't have anything to do at the moment with what's going on with the bridge. That's a specifically funded project through the Department of Transportation and HCA. So thankfully, we're not relying on any of that for this project. That doesn't mean you can't still write a letter of support, you know?
Okay, great.
You can
Thank
always
you. I appreciate that.
I would say reach out to me directly. I'm in Taos, and we're working on a project for the bridge. We're creating an auditor position that's going to monitor all this, and then we're also doing a mental health education program. So reach out. I would love to know, you know, I know Rocky Mountain Youth Corps, but let's kind of collaborate and see what you guys got going on.
Okay. Do you mind giving me your email real quick, and I'll put it in the draft email?
Yeah, helpoutreachtaos@gmail.com.
Help outreach. Is it health or help?
Help. H-E-L-P.
Help outreach. Got it. And your name's Stephanie?
Yeah.
Thank you so much. Appreciate it.
Sure.
Any other questions? All right. Thank you so much for the update, Stephanie. We appreciate it.
Sure. And if anybody wants to reach out directly and has any questions, I'll be sending the repository website to the whole group. But feel free to reach out if you have any questions about updates or anything at all.
Perfect. Thank you so much. We appreciate it.
Thank you. Okay, bye.
All right. Did Clary join Carolyn to give the, I believe Clary's giving the RFA opportunity update, right?
Anna Maria Dahl will be doing the RFA update.
Oh, okay. I missed that. I'm so sorry. So Anna Maria, are you with us in the meeting?
Yes. Hi. Anna Maria Dahl, she, her pronouns, and I'm the Violence Prevention Program Unit Manager at the Department of Health. Currently, our program has 4 different issue areas: gun violence prevention, community violence prevention, suicide prevention, and sexual violence prevention. And what that means is that the general fund and the legislature funds these prevention programs. So the funds come to us for us to give out to the community to do great work through a public health approach to violence prevention. And so what we would like to do going forward for fiscal year 27 is change up how we issue those funds. In the past, it was a different process for every program. And so now we're going to streamline things and invite folks to apply for the suicide prevention funding, the gun violence prevention funding, and the community violence prevention funding. And so, like I heard someone mention earlier, some funding fell through for a project for LGBTQIA Two-Spirit suicide prevention event. Please apply. We would love to hear your proposal for a project like that. That sounds like something right up our alley. And so we will be opening up that process very soon. We're sending it through all the powers that be to review our RFA packet. And we will be launching that as soon as we can with a July 1 start date in mind. And we will be hosting an information session. And so we will be getting all of that information out to you folks so that you can come and ask us any questions. And I will put my email in the chat as well. So you can email me any questions you may have in the interim. So thank you for the time, and let me know if you have any questions.
And Abe, you asked a question about the information. I attached the flyer to the invite for this meeting. More information will be coming out. I'll send it to our entire group, which is about 400 people. So we're doing good. Thank you.
Thank you so much for that update. We appreciate it. All right. So any coalition member announcements? I'd like to just open up the floor if you want to raise your hand or just unmute. Any updates that you have coming from the programs you support or the communities that you support, please share them with all of us.
This is Joanne Palomino with Department of Health. Our Road to Recovery 5K walk is canceled due to the weather. So we'll start it back in March, we're thinking. So I will let Carolyn know when we do have that.
Thank you for that update, Joanne.
You're welcome.
Anybody else?
Hey, my name is Athena Huckabee. I'm the chair of the Las Cruces Suicide Prevention Task Force, located in Las Cruces, New Mexico, but we serve all of Doña Ana County. We just launched our 8-week, it's our 4th cohort of the 8-week Survivors of Suicide Support Group series. So this is a peer-led support group. There's one in Albuquerque as well, is my understanding, separate from us. And so we've launched that here and just started the 8-week group, again, the 4th cohort. So we're hoping to do another one. We're hoping to do 2 a year. And then we also have the ongoing drop-in groups going on for people that have been have already gone through an 8-week group. So that's pretty exciting. And, I know myself and our treasurer, Shara Thorpe, are trying to be more active and engaged in these meetings. And so just also wanted to introduce myself and say hello, and I'm grateful to be here. And, hopefully we can all collaborate and information share more across the board and across the state.
Thank you so much, Athena. And welcome to the coalition, and we look forward to seeing you here too. Thank you. Anyone else want to provide any updates? Looks like I got a hand up. I got 2 hands up, but Abe, I think yours went up first.
Hi. With Breaking the Silence, we have a new youth advisory group that we're going to be launching this fall. So we are just like very putting the fine tuning on everything, and we'll be releasing some of that information here soon. So it's going to be based in Albuquerque. Our youth advisory group is going to be made up from 15 to 18-year-olds, like high school students, basically, and they're going to help kind of guide us in our curriculum, like what makes sense, what doesn't make sense, and how we can improve that. And then as well as just create a space for these youth just to be in a safe place and have open ideas and try to be creative and just have like human connection again. So we're gonna do that here in Albuquerque for the fall semester. And then just depending on how that rolls out, we might expand it virtually to the rest of the state. But right now, just since it's the pilot program for us, we're doing it kind of small and just keeping it local to Albuquerque. But we'll be sending out information as that progresses.
Excellent. Thank you so much. All right, Marvel?
Yeah, I just want to do a quick update on ABC suicide prevention. And we have free classes for anybody in New Mexico. And we have just launched our on-demand self-paced class, and I will put that link in the chat. And so we offer a 6.5-hour suicide prevention instructor course, and then 1-hour classes. Those are available in Spanish and English. And now we have the online self-paced class also. So thank you. And thank you everybody for all of the work you do across New Mexico for suicide prevention.
Thank you very much, Marvel. Margot, good to see you.
Good to see you too, Kate. I just wanted to make a little bit of an announcement. Bernalillo County has developed the Office of Prevention, which is under the Department of Integrated Services. We're building that out currently. I've been reassigned to the CARE campus, where we will be working to build out the Office of Prevention, and this is all part of the strategic plan for the Behavioral Health Authority Division. So it's really exciting news. This is the first office that we're starting to build out, and so I'll be here from now on. I dropped off for a little bit, but the department is also working with Keep NM Alive, which will also be focusing not solely on fentanyl. We're going to break out into alcohol, suicide prevention, all those different things. So just really exciting news. So I'm really glad to be here.
Thank you so much, Margot. Any other updates from any of our coalition members?
Hey, Kate, before
Yes.
before we log off, I just want to say how amazed I am by everyone on the meeting today. I mean, from Dylan's presentation, which is always amazing, to everybody's, everybody with their updates. There is a lot of efforts going on across the state, and you guys are all making a difference, and it just really warms my heart. I mean, that's an incredible amount of work that everybody's putting aside, and I just want to say thank you.
Thank you for that, Paul. And I was thinking the same thing. And I was thinking too, as we're getting some of these updates and some of the comments and introductions we've received from many of our coalition members today, that Carolyn, we may want to come up with some sort of a list to put on our website that outlines these programs going around to give, a further support to these community-led projects or programs, as well as to kind of keep them all in line so we can keep track, because there's so much going on. You all are doing such great work. So I think that might be something we want to explore, explore doing. So, all right. So if there's no other announcements or resource sharing, looks like we'll probably wrap up a few minutes early today, give you a few minutes to maybe go get your lunch or finish up your lunch if you were using the time with us here today to eat your lunch, or just even get up before your next meetings. As a reminder, we do quarterly meetings for the coalition. So our next quarterly meeting is scheduled for April 24th. That is a Friday. Same time, same place. We look forward to seeing all of you. As a reminder, based on the agenda and the call for ideas for presentations or topics that you would like to hear in April or beyond, in our Q3 and Q4 meetings, please let us know. Connect us with anyone in your network that you feel would be good to come and share information, or with yourself. If you have a program or a project going on that you would really like to share with the coalition, let us know. We'd love to have you. If there's not any questions or any comments remaining, then I think that we can give you back about 13 or 12 minutes at this point of your day, and look forward to seeing you all in April. Carolyn, anything else you want to say before we go?
Just to thank you and Paul. We totally appreciate both of you for hanging in there and doing this for our entire state. And thank you to everyone helping with suicide prevention in New Mexico. Stay safe and stay warm this weekend.
Yes, thank you very much. Thank you. Take care, everybody. We'll see you in April, if not sooner.
Thanks, everybody.
Bye-bye.
Bye-bye.